So that was the basic classification of basic DNA viruses. Let's try to zoom in into each. The first one we're gonna cover is Parvo b19, right? Now this Parvo b19 is one of the exceptions in DNA viruses because it has a single-stranded DNA. Okay, so it's a single-stranded DNA, right? And it's a linear DNA in Parvo b19. And the clinical vignette usually we have is child has sickle cell, attacks anemia, has low reticulocyte count, and a cheek rash. So that's a clinical vignette, right? So let's try to learn that concept. Very simple. Let's start by Parvo b19. Okay, so Parvo b19, right? I think pretty cool name. Okay, so Parvo b19 super ideal. Now its favorite target is erythroid precursors, right, in the bone marrow. So I'm gonna write that down. Erythroid cells, precursors. Now of course they are present in bone marrow, right? Now I'm gonna give you the reason. It's a single stranded, by the way, single stranded DNA. Okay, linear. It's a linear. Okay, gotta write that L. So the key is the key to almost every manifestation. Wow, what an accent. So the key to understand this virus is that it always expresses something which is called as, I'm gonna write this as P antigen. P, something with P. So P antigen, right? It has a story. Now what's the story? P antigen is that Parvo b19 expresses this P antigen, and what it does actually is that it's this P antigen is actually, it is found on every erythroid progenitor cell. Okay, now these are these developing RBCs, right? So whenever we see any sort of Parvo b19, we should really think about bone marrow, red blood cell, anemia, reticulocytopenia, there's cheek rash, sickle cell, aplastic crisis, hydrophthalamus, right? Arthralgias in adults. Arthralgia is just pain. Okay, so the virus is like a tiny saboteur, and it sneaks into the RBC factory and it shuts down the production. So that's the basic idea of Parvo. Okay, so the fifth disease, there's a disease called fifth disease, right? So fifth, let me open it up more about it. So fifth disease, classic pediatric presentation. We have fever, we have malaise, we have this fever and malaise. It's followed by a bright red cheek. So I'm gonna write bright, I'm gonna just write red cheek. Okay, red cheek. And then we have this reticular rash on the trunk and extremity. Okay, so we have reticular means strings like, okay, rash on the trunk. So that's the presentation, right? And we call this fifth disease, right, as erythema infectiosum. Erythema means red. Erythema infectiosum. I think very cool name for this disease. So erythema infectiosum. Now this slap cheek appearance is actually super ideal because once a child develops this rash, they are usually no longer contagious. Because why? Because the rash is not due to the active viral replication, it's due to the immune response, CD8, right? So this cheek rash is the sign of, what is the sign? The sign that it's no longer contagious, no longer infectious or contagious. Okay, so we have this rash, right? So what's the thing? So viremia, wow, sounds like a Russian word, viremia. So viremia, the virus inside the blood, right, appears the first, immune system produces the antibodies, and the rash appears. That means if the child has already the classic red cheek, that means the immunological response has cleared the virus. That's why parents can usually be, reassured. Now, why we have arthralgia? Okay, let me write that. Arthralgia. Why we have arthralgia? Well, arthralgia is usually present in adults, right? And adults often do not understand that this slap cheek picture. So we get arthralgia, we get arthritis, and we get rash, right? Now, we usually see this Parvo 19 in children, right? So where we will find children and adults together, we will find them in daycare workers, teachers, mothers, right? So this classic vignette is that female daycare worker, joint pain, wrist pain, knee pain, rash, exposure to kids, red cheeks. That's Parvo b19, because arthritis occurs because immune complex is formed after the infection. So in children we get the rash, in adults we get the arthritis. So arthritis happens because of immune complexes. That means this part of disease actually behaves more like a immune mediator inflammatory process rather than direct viral destruction, right? So this is kind of behaves like a immune mediated complex forms, right? Immune mediated inflammatory process, right? It's like an immune mediatory basically inflammation has happened because of immune system, right? Now, another point we should know is that why it affects the sickle cell, right? Why the sickle cell patients get aplastic crisis. Now, what is aplastic crisis? Aplastic crisis is just you're not making anything now, no RBCs, right? So cool concept. Wow, normally the RBCs they live about 120 days, right? But in sickle cell diseases, the shape is, we have HbS, right? Hemoglobin S. We have bad shape, right? Looks like a sickle. So in sickle cell, the RBCs are destroyed much faster, right? In around sickle. So the sickle RBC actually dies around 20 days, right? Dies in around 20 days. Now it's gonna die in 20 days. That means the sickle cell patients are constantly depending upon their bone marrow to rapidly replace the RBCs. Now imagine Parvo b19 shuts down the erythroid precursor. What is gonna happen? Of course, we're gonna have a catastrophic aplastic crisis, right? So in a healthy person, losing RBC is not a big deal, but in a sickle cell patient, it's gonna give you very catastrophic thing, right? So that's the thing. So what else? So if a marrow production is stopped or paused very briefly, what's gonna happen? What's the clinical vignette? The hemoglobin is gonna go down, right? Reticulocyte, right? They're gonna crash, and we have anemia because we have bad erythroid, right? And we call this thing as transient, bees for little time, aplastic crisis, TAC. Wow, transient aplastic crisis, right? So that's aplastic crisis. Child with sickle cell, fatigue, pallor, anemia, very low red blood cells, very low reticulocyte count. Low reticulocyte count is especially important because sickle cell patients usually have elevated reticulocytes, right? Because their RBC is working, not RBC, more marrow is working hard, right? So they have higher, but due to the b19, it goes down. So if a sickle patient has anemia, right? He has anemia and he has a low reticulocyte count, right? We should think about Parvo b19 until it's proven otherwise, okay? What else I can say? We have pure red cell aplasia versus aplastic anemia. It's cool name, cool, very cool sounding concept here. Okay, we have, wait, let me change the color. Let's make it bright yellow. Yeah, so we have pure RBC aplasia versus we have aplastic anemia, right? Let's try to understand that. Okay, so Parvo b19 classically causes pure RBC aplasia, okay? Not the aplastic, not whole marrow is shutting down, just the RBC line is getting affected. So what we will get actually is we will get, let me put that down here actually, because it's part of the Parvo, right? So what we're gonna get here is that we're gonna get RBC is gonna crash, the reticulocytes gonna crash, the WBCs are gonna be okay, they're gonna be okay. The platelets, they're gonna be okay, because we have pure RBC aplasia, okay? But in severe cases, especially in immunocompromised patient or in fetuses, you can have a broad spectrum suppression of marrow, okay? So pure RBC aplasia is much more classic, right? Now, why we see a broad spectrum aplastic anemia in fetus, right? So what happened here is that in fetus, b19 actually destroys the fetal erythroid precursors, right? Now it becomes really anemic, right? The fetus becomes anemic. Now severe fetal anemia can lead to high output heart failure actually, right, in the patient, right, and edema, because we are not making enough albumin, right? And we call that this edema, this presentation of edema is called hydrops fetalis. Blood. Hydrops fetalis, right? Okay, so this is one of the major reasons Parvo b19 is very dangerous during pregnancy. So gotta write that down. Be aware of the pregnancy. So pregnancy. Okay, so classic clue: pregnant woman exposed to a child with fifth disease, and we see fatal hydrops on ultrasound, and then we have severe fetal anemia. Now, how can we diagnose this? Well, very simple actually. For uncomplicated rash disease or arthritis, we should check for b19 immunoglobulin M, because we should check for IgM. Okay, and if there is severe anemia or reticulocytopenia, or we have problems in marrow, then we should go for bone marrow biopsies, okay, or bone marrow biopsy in case of any sort of complication, right? On the biopsy, cool thing we're gonna see is something we call as giant, because they're dying, right? They're dying earlier, so that's why they're giant. Usually this precursor goes, the size goes lower, the size actually decreases as the precursor cells they mature, the size actually goes down. So the giant, we will see, what are we gonna see? We're gonna see giant pro normal blasts with viral inclusions, okay, with viral inclusions, inclusions. Okay, so that's it. That's the Parvo b19. That's it, man. That's it. Yeah, so that's the whole topic. Let me summarize the whole topic for you. Wait, the whole topic is that we will have single-stranded DNA, arthralgia, pregnancy, IgM, Ig bone marrow, giant pronormoblast, viral infection, erythroid bone marrow, immunomediated inflammation. RBC usually 120, but in sickle cell is 20, so that's why we have aplastic crisis. Usually pure RBC aplasia, hemoglobin goes down, reticulocyte goes down, anemia. What else? Usually RWBC and platelets are going to be okay. We call it fifth disease because we have 5 things, right? Rash on the trunk is later, red cheek is before, and before that we have some sort of fever and some sort of myalgia. Okay, so slap cheek rash, fifth disease, reticular rash on the body, daycare workers, sickle cell, right? Edema, we call it hydrops fetalis, right? Seen on the ultrasound, pure RBC, bone marrow, right? So that's it. Now, in the end of the video, you should really ask yourself, why does the Parvo b19 prefer erythroid precursor? Why is the rash seen after the viral clearance? Because I'm not going to tell you, right? It's an immune mediated. Which immune? You should know that. Why reticulocyte count is so important in recognizing Parvo b19. Why the Parvo b19 causes pure red blood cell aplasia. Why daycare workers are usually affected. What can happen in fetus? What's the normal erythroid? What are we gonna see on the biopsy, right? On the bone marrow biopsy. Why can Parvo b19 mimic rheumatoid arthritis in adults, right? What is the lacy body rash that can often easier to be see that is often easier to see after the slap cheek rash actually fades away? Why can a child with this fifth disease actually returns to school once the rash disappears? Why is that? And why Parvo b19 is such a common virus in compared to other viruses with childhood rash? Because it's not lethal. That's why it's common. It usually gets resolved. I'm not gonna say much. So that's end of the Parvo b19. That's the complete thing you need for Parvo b19. That's it. You don't need anything more to solve questions. I think so.